Hello guys, welcome to week number 4. So this week we have 2 chapters again that we're going to be focusing on. Those are chapter 30 and chapter 37. Chapter 30 will look at the digestive system, and chapter 37 we're actually going to be focusing on specialties and assisting with specialties. So for chapter 37, I'm really only going to focus on pages 839 through 846. So let's jump in. Let's give a quick review on those 2 chapters, and we're going to start with chapter 30. So chapter 30 is actually going to start our discussion on the digestive system. The digestive system has 3 main functions. It is to digest, absorb, and eliminate. So digestion, absorption, and elimination. And the main part of your digestive system is what we call your GI tract, or gastrointestinal tract. This tract is about 30 feet long and starts at your mouth and will end at the anus. So it's actually going to go all the way through your body, essentially. The digestive system is a series of hollow organs joined in a long twisting tubes as a form of a tract. Some of those organs are your mouth and teeth, the pharynx and the esophagus, your stomach, the small and large intestine, and then obviously down to your anus. So let's kind of talk about each one of those areas a little bit more. So the mouth is really where your food comes in and your digestion process starts. We begin with the chewing process, and when we chew, what happens is we secrete saliva, which then moistens our food and makes it the chemical breakdown of our food start, and then we swallow it. And then that ends up going down into our stomach. Now, really, we use our teeth in this manner, obviously, to help us chew and break down our foods for those digestion. It's important to know that as adults, you do have 2 sets of teeth. One comes as a baby set, and one comes as your adult or permanent set. Your baby teeth are about 20 teeth, and your permanent set has about 32. Imagine that. Your pharynx and esophagus are next. The pharynx is really a passageway for both air and food, and it lies in the posterior to your mouth, so the back of your mouth, and is the beginning of the tubal components of the GI tract, and that helps lead down into the stomach. Your esophagus is a collapsible tube that's about 10 inches long and starts at your pharynx and actually ends at the top of the stomach, or the beginning of the stomach. Your food and liquids are carried down to the esophagus by muscular contractions. So think about it kind of contracting the food down. Once we get through there, we're going to hit the stomach. And this is a large muscular sac-like organ. And this is really where, that digestion is going to continue. That process is still going. Your stomach can hold about 1 to 1.5 liters of fluid or food. So that's quite a bit amount. I mean, think about when you get a liter of soda. That can be held in your tummy all day. From your stomach come your small and large intestines. Small intestine is first, and that's about 2 feet long, about 1 inch wide, and it is coiled within the lower part of your abdomen. The first 12 inches of that are going to be the duodenum. The next 8 inches make up the jejunum, and then the last 12 are the ileum. So you think about that all kind of compiled into a 2-foot range of coiled intestine. From your small intestine come your large intestine, and this is about 5 feet long, and it's about 2.5 inches wide, so a little bit bigger. And the function of your large intestine is really to complete digestion and start that absorption process. Now, your large intestine is divided into 4 parts: the cecum, the appendix, the colon, and then your rectum. All right, I'm going to leave it up to you all now to read the rest of your chapter, and it's going to go through some of the common disorders and diseases that are associated with the digestive system. So please make sure that you read those, because it may help you with a future assignment or a future discussion post for this week and future weeks to come. So let's switch gears. Let's talk about chapter 37. And again, this is discussing assisting with specialties. And again, you're really only going to need to look at pages 839 to 846. So the role of a medical assistant is to assist the physician during special exams and different procedures, but also instructing the patient before, during, and after those procedures about what they're going to be responsible for. A gastroenterologist is a physician who specializes in the diagnosis, treatment, and management of diseases related to the digestive system and its associated structures. So if you were to be working in a gastrointestinal office, you're going to be working with a gastrologist. As the medical assistant working for this type of provider, you're going to be responsible for quite a few of the things that are a little bit different, some that are similar to working with a regular family doctor. You're still going to be responsible for rooming your patients and obtaining the vital signs. You're still going to be responsible for reviewing the medical history and comparing it to other GI-related questionnaires. Those are really going to be more specific to the provider you're working for. So please make sure, if you're going to be working in this type of office, you see if there are any specialty questions. As a medical assistant, you're still going to be preparing the exam room and assisting with specialty procedures. Those could be things such as a colonoscopy or a sigmoidoscopy. A colonoscopy is a procedure that is going to examine the large intestine, and it screens for colon cancer. A sigmoidoscopy is an exam that looks at the interior of the sigmoid colon and uses that for diagnostic purposes. As a medical assistant, you're still going to be instructing patients, but now you're going to be instructing them about collecting stool samples, and then you will be running and performing tests on those stool samples. Think back to lab skills when we were working with Hemocold testing. So those will be things that you will be responsible for doing. You'll also be providing instructions for patients about the prep for GI procedures. So maybe it's a prep for a colonoscopy or a prep for a sigmoidoscopy. You're going to be responsible for doing those things now. And you'll also be responsible for providing education and support on the treatment protocols that the provider sets up for the patient. Alright, this is where I'm going to kind of stop for the video and the overview for this week. As always, please make sure that you are reading your chapters in full so that you can be knowledgeable and ready for the lab class and assignments and discussion posts. This week you do have one discussion post, and that's going to be about that colonoscopy procedure. You will need to describe 2 reasons that a colonoscopy might be ordered and explain what the patient will need to do to prepare for that exam. You will also need to explain how you will prepare and educate the patient for that examination. Please make sure that your initial discussion post is posted Tuesday by midnight, and your 2 classmate responses are completed Saturday by midnight. Also this week you have 1 written assignment. For this assignment, you will need to create an informational brochure. Now, no, this can be done in Microsoft Word. If you need help with that, please come see me, and I will help you with that in any way that I can. This brochure will need to explain one of the GI procedures that are listed within the assignment on Angel. So please make sure you're actually going into the Angel account. You're looking at the assignment for this week so you can pick a correct procedure. It should be no more than 1 page in length. So it doesn't have to be a lengthy brochure, but it should go over the information, and it needs to be written in terms and words that the patient would understand. So that means no medical jargon should be used in this procedure brochure. It should be useful and helpful to the patient, so keep that in mind when you're putting it together. This assignment is due Sunday by midnight. And last thing that I want to remind you for this week is you do have your mid-quarter surveys that are going to be out. Now, I can't make you do this assessment. It's not required. It's not an assignment. You're not getting points for it. It doesn't count for a grade. But myself and Rasmussen really do appreciate you giving us any feedback that you can about the course and about myself as the instructor. So please put in that effort for me. It only takes just a few minutes, and your thought and effort really is very important to me and the Rasmussen community. It is anonymous, so please don't think that I will know if you say anything bad about me. I just appreciate any feedback that we can get on that survey. Alright guys, that is really all that I have for you this week. I hope you all have a wonderful week, and I will see you on Tuesday. Bye guys.